I would suggest this. In fact, I was talking to a friend today and I said, you have to go there, because she had experienced the same thing I did. She didn't want to go back to the sclerosing. I said, you go to Dr. Moak. They're so professional there. They treated me well. I'm very attentive, and I was very impressed. So I have advised her to come here.
Varicose veins are extraordinarily common. We think they affect about 40 or 50 million people in America. About 1 million people in America a year wind up developing ulcerations or significant complications of varicose veins. The more common reason people seek treatment for varicose veins is because of their appearance, because they're sore, because of heavy legs, because of restless legs, because of swelling, itching, or discoloration of the legs. These are common reasons to seek out treatment for varicose veins. When we decide to do a varicose vein treatment, one of the keys to successful treatment is figuring out why you got the varicose veins in the first place. The biggest mistake is just to go ahead and treat the varicose veins without figuring out why you got them, because you'll get them back. Varicose veins are progressive and chronic disease, and you always have a propensity to develop varicose veins. So one of the key goals is to try to reduce the chance of you getting varicose veins again. You can never say that you will never get another varicose vein or spider vein. That'd be impossible. But your rate of new varicose vein or spider vein development goes down dramatically when you've had appropriate evaluation and treatment. So let's look at what causes varicose veins. Every time your heart pumps, it pushes blood all the way down to your feet. And somehow it's got to get back up to your heart. So there's a series of veins in your legs. You have veins inside the muscles that are generally healthy, and they handle about 95% of your blood flow. There's little valves inside the muscle veins, and every time your muscles squeeze, it pushes the blood back up to your heart. So it's a squeezing process that pushes the blood back up to your heart. Now there's veins in your skin that have to dump the blood into the deep system to get the blood back up to your heart. This is the most common source where varicose veins occur. There's little tiny valves between the superficial skin veins and the deeper muscle veins that control blood flow. They're supposed to be one-way valves. That way, when the blood goes up, the valve opens, and then as soon as the blood stops pumping up, they close, and that stops the blood from going back down. Now these valves, when they go bad because of stretching or because of some genetic reason, they go both ways. So as you're walking, the valves open up to let the blood up, and then instead of closing, they sort of go backwards, and the blood comes back down. When that happens, the blood builds up in the system called the saphenous system, which is the skin veins, and it causes varicose veins. Varicose veins are little veins attached to the saphenous veins that dilate, get enlarged, and get twisted, and that's the definition of varicose vein, a large twisted vein.
I've had varicose veins for a long time, and to look at them, they were awful looking, but since they're on my back of my leg, I really couldn't see them, didn't make much difference. But once they started to hurt, and I couldn't sit in the car, I couldn't sit in the chair, they got to be bothering so bad that I had to do something with them. So, and I was looking for something that was going to take no downtime. And this was one of the procedures that I found that was literally no downtime. As soon as I got out of the office here, I had to go walk for 45 minutes. So actually, you know, when I was done, I was going. I was actually walking, you know, right away. So.
By the time you have varicose veins, these veins are doing nothing. Some people would wonder, well, I don't know if I should treat these varicose veins, and I might need them later on. These veins are not working. These are useless veins. They're disease veins. I've also heard, well, I think I should not treat these varicose veins. What happens when I need them for a heart surgery down the road? Well, you sure wouldn't want to take a vein that's not working in your leg and lay it on your heart and kill you. These veins are of no use. There is no reason to keep varicose veins. The safest and most effective procedure currently is a combination of procedures. We don't do any stripping. Stripping is obsolete and not needed. We do an ultrasound and we comprehensively map out the veins. We look at the deep system, make sure it's healthy, that you can have your veins treated. And we look at the superficial, the skin veins, to see where the points of reflux or diseased veins are. If we don't treat the diseased veins underneath the skin, they'll come back. That is a key to treating the varicose veins. Spider veins are the little tiny veins that commonly occur in the legs or the lower abdomen, lower trunk, that are more of a nuisance or more of a cosmetic concern than a medical concern. If you have spider veins and they cause pain, usually there's some underlying disease that has to be addressed before you treat the spider veins. And this is something I'd like you to bring up with me if you have concerns about spider veins, that we treat the underlying veins first. If the spider veins are not associated with any swelling or pain, they can be treated at the surface and you get a good long-lasting result.
The procedure was very interesting. In fact, you watch it all on the ultrasound, which I was fascinated with. I was tilting my head back just to watch it all. And they go in there with a laser, he numbs your leg, and he actually inserts the laser into your vein, and it burns the walls of the vein. And it was actually very easy. The downtime was, I got up and left, and it was I thought I'd have to take Motrin, which he said maybe you would. Didn't have to take anything. It was very painless.
With ultrasound-guided sclerotherapy and endovenous laser ablation, that's using the laser inside the vein and the injection of fluid inside the vein, this is an extraordinarily safe procedure. It's by far the safest in the world right now. The most common side effect we see is going to be discoloration. The blood's pushed out of the vein, but there's still going to be some residual blood in the vein, and it's going to lead to bruising or discoloration. We see a bronzing or a brown discoloration where the vein was at. They can last anywhere from a month or two up to a year. Most commonly 3 or 4 months will be some discoloration. Another common side effect we see is called phlebitis. That's where the vein gets irritated. We've pushed the blood out, we've injured the vein, but if it doesn't get injured 100%, it'll get phlebitis, which means irritation of the blood vessel wall. It goes away in time. Sometimes it requires a second injection and additional compression. It's more of a nuisance than a major complication. The rare complications include ulceration of the skin. This is where some medicine might travel into a little artery and break down the skin. Very rare, about 1 in 5,000 cases. And blood clot. Blood clots that need to be treated are fairly rare. It's reported in the literature anywhere from 1 in 100 to 1 in 5,000. We find in our practice extraordinarily rare to get a blood clot. And if they do occur, you have to take a blood thinner for a couple of weeks. After determining to do a varicose vein procedure, one of the goals to get a good response is some compliance from the patient. What we like to see is after you get done with the procedure, we put the stockings on you. The stockings are fairly tight and uncomfortable, but you have to wear them. That's what assures a good outcome. We like you to walk 20 minutes or so before getting in your car. This assures that any medication is getting pushed out of your legs. We also find a much lower complication rate associated with immediate ambulation. So we like you to walk around before you get in your car, or if you want to drive to one of the stores nearby, you can drive over there immediately and then walk around for 20 minutes. That's a critical component. We'd like you to keep the stockings on at least 2 days after the major vein treatments. This keeps the vein compressed. There's different reasons you might keep the stockings on longer. Some people find that when they take their stockings off, they get a little sore. That's a reason to put them back on. Also, if you get phlebitis, which is like a redness and soreness, it's a good idea to put the stockings back on. When we say to wear them for 48 hours, I'm referring to wear them in general for 48 hours. You have to take them off to take a shower, to use the bathroom. That's fine. But we're keeping them on when we're walking around. And the first night, it's best to keep them on. After you have your vein procedure, it's important to do a lot of walking. We find that the lowest risk of complications is in the people that are most active. In fact, one of the groups of people we can't treat are people who can't walk. If somebody's in a wheelchair, they really can't have their varicose vein treated because they'll get a blood clot. If you lay down for hours after your procedure without walking first, there's a risk of a blood clot that goes up. And that's one of the complications we want to avoid. Best way to avoid this is frequent ambulation. You walk about 20 minutes before you get in your car to go home, and then the next couple days, walk 20 or 30 minutes 3 or 4 times a day. If you're traveling any distance, it's good to wear your stockings and then walk around frequently while you're traveling for the month or so after your procedure. This reduces complications after varicose vein treatment.
Before, it was a lot of the sclerosing with the needle going in. They didn't use the ultrasound, and he'd just go in and kind of pick around. And I really didn't want to do it again. That's why I put it off for so many years. And then you'd wrap your leg for a week. You had to be wrapped. This, your legs are wrapped for, or you wear the stockings for 48 hours. It's virtually easy. And I was so happy, even after the first treatment. I looked at my leg and went, "Oh my gosh, this is unbelievable." So I'm very excited. In fact, we're going on a vacation. I can actually show my legs.